Welcome to the AIAMC podcast. I'm Kimberly Pierce-Burke, Executive Director of the AIAMC, and this is the second in a two-part series where the AIAMC is visiting with some of our colleagues on the pharmacy side of the house. So I'm really excited today to be joined by Doctors Allie Schlichter and Mark Nagel. They are both with Unity Point Des Moines in Des Moines, Iowa. So welcome. We chatted with Allie a week or so ago with John Yost, who's the Chief Academic Officer. And so this is, again, the second of a two-part series, and we're so thrilled to chat today with both Allie and one of her recent graduates, who's just now starting out his career. So before I start to ask you a few questions, Mark and Allie, would you just tell us, your title, a little bit about what you do and how long you've been with Unity Point? Allie, we'll start with you.
Thank you so much. So my name is Allie, and I have been with Unity Point for the last 15 years. So I am the residency program director for the first year pharmacy residents, and I'm also the pharmacy clinical manager.
Great, thank you. And Mark?
Hi, yeah, my name's Mark. As you mentioned, I'm a recent graduate of the residency program here. So I've been with Unity Point for a little bit over a year now, but in my current role for a little bit less than a month. So still kind of getting my feet wet in my current role. And so I'm working as a clinical pharmacist, and I kind of rotate between different clinical sites, including like the adult critical care unit, our cardiology floors, and then some pediatric work as well.
Wonderful, very interesting. Great. Well, certainly those of us that are involved in the AIAMC have a very soft spot in our hearts for residents and for recent grads. So Mark, with that kind of context, I would just ask you, how did you choose pharmacy as a career? And tell us a little bit about your education and training. You mentioned it was for a year. Um, can you tell us why you chose pharmacy and maybe about a little bit about the different rotations you go through during that year of residency?
Sure, yeah, for sure. So in high school, I was very interested in science and health in general. And honestly, it's not necessarily like the most exciting story why I came to choose pharmacy. It was more of like a pragmatic decision. I wanted something that was stable and I felt like was rewarding work. And I
Mhm.
ended up shadowing with an oncology pharmacist when I was a junior in high school, and I really loved what they did and the collaboration. So that just kind of sparked my interest. And ever since then, I decided that's what I wanted to pursue.
Mhm.
As far as my education, I did 2 years of undergraduate work at the University of Iowa and then 4 years of graduate school there to earn my PharmD. And then, as you mentioned, I did the 1 year of additional residency post graduation. So there are a lot of different career paths in pharmacy. One of them, obviously, is becoming a hospital pharmacist. And that's the path that I chose to pursue because I feel like it has the most collaboration. And as far as rotations go, as part of our schooling, within our 4th year of graduate school, we do what are called APPEs, or advanced practice experiences. And those are rotation based. So I had a lot of those experiences at the University of Iowa hospitals and clinics. And then I came back to Des Moines. I'm originally from here for my residency and did, I can't even remember exactly how many rotations, probably at least 8 rotations. So some of our rotations are required rotations. So that includes kind of your bread and butter stuff like internal medicine, infectious disease, adult critical care, et cetera. And then we also get to choose elective rotations. So I did some interesting elective rotations like pediatric ICU, solid organ transplant.
Oh, wow.
So yeah, you kind of get a breadth and depth of experience through your residency training.
Interesting. I'm truly learning something every time we have these conversations. So is the 2+4 a traditional route to the PharmD? Is I guess I was thinking it was more of like a 5 or 6 year. Well, I guess that would be 6 years. Is that a traditional route to the PharmD?
Yeah, no,
Two
that's a
plus
great
four.
question. So I believe most pharmacy programs now will accept applicants that have 2 years of undergraduate coursework as long as they have like the required prerequisite courses, which is what I
Okay.
chose to do because I kind of knew going into college that this is the path I wanted to
Hmm.
pursue. But in my graduating class, I would say it was honestly pretty close to like a maybe a third split between people that did 2 years, 3 years, and then people that had like a full like biochemistry degree and then went to pharmacy school. It was a pretty even split between those three categories. I just kind of did the fast track because I knew that's what I wanted to do. And it saved a little bit of money, which was also
Yeah.
great. So,
Yeah. Yeah, because you made that decision early and you had that
mhm.
opportunity to shadow, which is incredible. That's you're very and I know you know that, but that's very fortunate that you could do that. So, Mark, what were some challenges that you faced during your training? And were there any surprises? You mentioned, sort of some of the basic rotations that you had, some of the electives that you took. Um, what was something that was a challenge, and did anything surprise you during that year of training?
Yeah. I think like the biggest and most obvious challenge is time management. You're juggling a lot of different things between you have like projects that are assigned to you throughout the year and longitudinal projects. And then on
Mhm.
top of that, you have your clinical rotations where you're trying to just soak up as much information as possible from your preceptors and learn as much as you can about whatever, functional area your current rotation is in. You'll do topic discussions and kind of things for your rotations as well. So it can get to be a lot at times. I think time management is probably the biggest challenge, but that is something that you kind of know going in, and also like
Mhm.
grad school prepares you very well for that, right? You have to
Mhm.
be effectively managing your time throughout grad school. So I think that's something that I did kind of expect going in, but definitely is a challenge. As with a medical residency, time
Right.
management is a big thing as well. I think really the biggest surprise to me, there weren't too many surprises throughout residency, which I think is a good thing. It's kind of like a testament to the program. Allie does a good job of letting us know at the beginning kind of what we're getting into. And the fourth year where you're doing rotations kind of like tease it up for if you want to do residency. I think the biggest surprise to me, though, would have been my research experience. I kind of came in. Um, so research is a required part of a residency program. I kind of came in thinking, I was just going to do it so that I could check the box and get it done. I didn't have like a huge interest in research coming in. I didn't necessarily think that my project would be um, very like impactful, but it actually ended up being something that I became very interested in as I was doing the work and the data collection and reading more and more about the topic that I chose to research. And when I presented it to our critical care subcommittee, some of our like physician leaders within the critical care team here, so our intensivists, were very interested in the research as well, and actually encouraged me to potentially look at like publishing or presenting. So that was a big surprise and kind of a happy surprise for me that it ended up turning into something that I am very proud of and would be happy to like eventually put my name on it and publish. I haven't gone forward with that yet, but definitely considering it, and something that going in, I didn't think that that would be the end result of it, to be completely honest. So,
That is tremendously exciting. So tell me a little bit about the research. If it
cool.
involved critical care, I kind
Yeah.
of have a picture, but tell me more about it.
Yeah, it is kind of a niche topic, but what I chose to research was fixed dosing versus weight-based dosing that is like titrated to effect for cisatracurium, which is a paralytic that we use sometimes in our critical care populations. So usually patients presenting with severe acute respiratory distress syndrome or ARDS. Sometimes we will paralyze them when they're fully sedated in order to kind of help them be more compliant with the
Mhm.
ventilator. And I was
Mhm.
really just comparing those two dosing regimen, that fixed dosing versus a weight-based dose, which is titrated to effect. And what I found is that the weight-based dosing was just as effective, if not a little bit better in terms of clinical outcomes, and it used about 60% less drug. So
Oh, wow.
obviously cost benefits, but also considering the side effect profile, things like
Yeah.
muscle weakness, which are expected after you're on a paralytic, kind of reduction in those things, potentially with using the weight-based dosing a little bit more. So
Wow, those are significant findings for sure. So good for you. And as you're talking, I'm just thinking about the years I've worked with medical residents, and I'm sure they would agree that time management is is a skill that um, one knows one needs. But golly, when you're really like in the midst of it, it can be overwhelming, and it's something we're constantly honing and getting better at. And I remember working particularly with a general surgery residency where there was an optional 6th year of just research. And it was so interesting to see the general surgery residents coming in and the ones who early on said, oh, I want to do that extra year. And we could only accept so many. I want to do that. And then the ones, I don't know, that's not my interest. But then as they went along, like you, Mark, they really did develop an interest. So a lot of parallels there. Well, Allie, I'd love to hear from you as Mark's talking about the rotations that he has had. He said he was very well prepared by you and there weren't a lot of surprises. But with your program director hat on, what kind of support is provided to your residents? I mean, on the medicine side, we talk a lot about physician well-being and making sure that we're not looking at burnout and life-work balance, and in addition to the obvious things of clinical skills and et cetera, et cetera. So in your role as program director, how do you support resident graduates like Mark? And, what do you think are some of the most important things that pharmacy residency program directors need to be doing?
Yeah, definitely. I think it's really important to get to know the residents and see where their interest areas lies. Obviously, we have projects that are going to be assigned, and some of them are, new drugs that come to the market, they have to be reviewed, or new guidelines come up and, we need to review our order set. So there's a lot of projects that need to be done. And assigning projects that match the resident's interest area, I think is really helpful. You want to assign a project that will directly relate to patient care, that follows evidence-based recommendations, and sometimes end up saving costs to the organization as well. So I think being cognizant of supporting the residents, you do have to, cross off these boxes in order to get your residency certificate at the end, right? We're an accredited residency program, but the way we cross off those boxes are, left up to us and our sites. So assigning projects, I think, that are impactful, that relate to the residents' interest areas are helpful. I think some rotations are going to be more intense than others, so critical care is going to be very intense. There's, some new disease states. There's
some really sick patients
there. Yeah, really sick patients. So that takes up a lot of time, and while they round in the morning, they also spend the afternoon as kind of the staff pharmacist. So verifying those medication orders that come across, completing the consults, managing the antibiotics that the patients are on, making renal dose adjustments. So we're working throughout the day, not just on rounds, but taking care of patients, through the entirety of the shift. So it's hard to assign projects on those types of rotations. You do want to adhere to the duty hour requirements. We have the same duty hour requirements as GME. So we don't want our residents to go over, an average of 80 hours per week, and I always tell the residents, if you're approaching that, please let me know, because there is a disconnect. We certainly do not want to even be approaching that during pharmacy residency. But, we do have to adhere to those same requirements. ASHP, so I mentioned in the previous podcast that that's our governing body that accredits our residency program. So they actually this past spring released some well-being and resiliency kind of a packet or a calendar of topics to consider, to have residency program directors kind of discuss with their residents throughout the course of the year. So those topics varied based on, receiving feedback, to financial planning, to also offer a variety of resources available to kind of hone in on some of those, I'm an adult now, I've graduated, some of those life skills that are, sometimes can be tough to transition when you're managing a, 60 to 80 hour a week job too. So we do focus on those. We utilize those resources from ASHP that we receive. We try to incorporate wellness and well-being, and as Dr. Yost likes to say, well-being and work integration. And so we do try to incorporate that in as well. So like last year, we made haunted Halloween houses. That was a resident preceptor activity. And then we had our pharmacy department, vote on their favorite house. So try to, encourage collaboration between our residents and our preceptors as well. We do some like meet and eats over lunch. So just stop and have, lunch together. coffee connection breaks, those types of activities as well. Sometimes we go out, and we went to Top Golf a couple times last year. So those were a way that we could spend time getting to know the residents, and the residents could spend time getting to know the preceptors outside of, the four walls of the hospital too.
Mm-hmm. Yeah, what's coming through so clearly to me, Allie, is getting to know that person for the person they are. Yes, they're fulfilling a role, they're completing a requirement, but they're a person. And really getting to know them, what makes them tick, what will interest them, what will keep them motivated. And I mean, that's important in any leadership position in any discipline, even outside of medicine. So kudos to you. You mentioned collaboration and some collaboration between preceptors and the residents. And Mark, you mentioned with your research project having some collaboration with the intensivists. But has there been, not but, and have you had collaboration between pharmacy resident, when you were a pharmacy resident, and the residents in GME? And were there any collaborations, and what were those like?
Yeah, definitely. That's one of the things that I really loved about doing my residency training here is that there are so many medical residents throughout the hospital that you work closely with throughout pretty much all of your rotations. I can only really think of like one or two where I wasn't working closely with a medical resident on a daily basis. So you also get to develop like those relationships with them. And a lot of times they're similar to us in age, have similar experiences. So it's fun to kind of get to know them and be friends at work. And even like some of them we've gotten lunch or like met outside of work, which is a great time. But yeah, as far as like the collaboration we do, some of the things that come to mind, we do journal clubs with the internal medicine residents, and we're invited to all of their journal clubs. But a lot of them did come to our journal clubs when it was time for kind of the pharmacy residents to present, and they asked us questions and were engaged, which I appreciated. We also present our QI projects alongside the internal medicine residents. And then, I worked with like the surgery residents when I did my surgery trauma rotation. I worked with the pediatric residents throughout the year. So you get a lot of interaction with the medical residents throughout the course of the year. And I think it's kind of like a unique scenario where you have your co-residents that understand what you're going through, and you can kind of like rely on them to get through the year. But also all of these medical residents are at a similar point in their training. And you kind of get to have that shared experience with them as well. And you teach each other things throughout the year. They teach me plenty of things about medicine, and then they ask me questions about pharmacy, and I would get, spoke messages throughout the day from some of the residents. Hey, what do you think about this dose? Or, hey, what do you think about trying this medication for this patient? And that's the sort of thing that made me want to go into hospital pharmacy, is having that collaboration and feeling like the work that I do is rewarding. And I get to work as part of a team towards like a shared goal of helping a patient get better. So,
Yeah. I mean, my heart is just swelling right now. But I mean, when we think about it on the GME side, I mean, no provider is out there on an island. You're working in teams. I mean, you have to, and you have to work in a team if you're going to do what's best for the patient. So to learn that in such a natural, evolutionary sort of way while you're in training, I have to believe that will just carry on into practice when you've already been establishing these relationships, and you see the value in the other team members on the team, and you see that you can learn from everybody on the team regardless of their discipline. And I also love that I'm hearing two-way street, so it's not just, oh yeah, we can invite pharmacy to such and so. Well, pharmacy invite the residents to your journal club. Have those invitations be reciprocal. Have that be on an equal footing, I think, is super important. Allie, anything that you would like to add about collaboration between pharmacy and GME before I ask some quick fun facts and we wrap?
Yeah, I mean, it's hard to follow up what Mark said. I think that really speaks volumes to pharmacy's just collaborative role in general. Oftentimes we are decentralized, so we're sitting on the floor. We're working closely with these medical residents, and oftentimes we're easier to access than the attending providers are. So oftentimes we get triaged a lot of the questions too. So that just is part of our daily workflow, collaborating with the residents. So it's a really good environment, I would say. The only additional thing I would add is we do have a resident quality committee. So we sit on that. So as the RPD, I sit on it. We also have a nursing residency program that sits on it. All the rest of the medical residency program directors sit on that, and we review the RL reports, so the error reports that get sent, and then we try to come up with problem solving techniques or workflow solutions to those along with our quality partners. So that's a way that we can collaborate monthly and have a good kind of collaborative conversation to work through process changes too with our colleagues.
No, that's great. And I think it was National Initiative 3 or 4. We're in 10 now. So many years ago, the formation of resident quality councils was very popular, a very kind of hip thing to do now. It's pretty just standard. But those, our members listening and our friends listening, if that resident quality committee is not, quality improvement committee is not interdisciplinary, then I would say you're behind the times. Make it so. Have the other learners in your institution be represented on that quality committee is super important. So, well, we're going to close with something I just like to do. It's called Fun Facts. And we've been talking a lot about work, although we've talked about the importance of knowing an individual for who they are. But I'd like to close with just some quick questions so we can get to know our friends Allie and Mark a little bit better here in our closing moments. So 2 questions for each of you. I'll start with Allie. Your favorite type of chip?
Oh, my favorite type of chip. Normally I go for pretzels. Does that count?
I like the salty. Yes.
Yes. Yes.
I think I asked you last time salty or sweet, and you said salty. So I should have seen that coming.
I mean, sometimes I'll put chocolate covered pretzels on it too. So you can do both that way.
You want to be equal opportunity. I get it.
Right.
Okay. Sounds good. Mark, what is your favorite holiday, sir?
My favorite holiday would have to be probably Thanksgiving. Obviously, you get to eat a bunch of great food. My aunts always make multiple pies, which is awesome. And then I'm a huge football fan as well. So there's games on throughout the day. I'm a Bears fan, so they don't usually win, at least in my lifetime, but I still like to watch all the games, and I think it's just a great time to get together with family. So Thanksgiving would be my favorite holiday.
Oh, that's wonderful. That's really special. You don't hear that a whole lot. That's really nice. Now I hear you say the Bears, and I know on Thanksgiving Day it's usually pros who play. But do you like college football as well? And do you watch the Hawkeyes?
Yes, definitely a big Hawkeye fan. My family's kind of unique in that we have like a bunch of Big Ten schools represented throughout our family. So the Hawkeyes are my top team for sure, but I also my brother and sister both went to Michigan, so I root for Michigan. My parents went to Illinois, so I root for Illinois. And then I have cousins that went to like Nebraska, Purdue. We've probably got half the Big Ten covered. I mean, it keeps growing, so not half anymore. But between my family and extended family, we've got like half the Big Ten covered. So,
well, let me add to your family. I am in my Scarlet Red today. I'm an Ohio State Buckeye,
okay.
and I like you, even though you have some family that went to that team up north, as we call it. So, Allie, what is your favorite month of the year?
Oh, I would probably say summer to fall. I don't know if I have an exact favorite month. I do a lot of running, so that's usually when the weather is best to kind of run outside and see the sunshine. So yeah, I'd probably guess around September, October.
Yeah.
That time of year starts to get a little bit cooler in the morning.
Yep. I love that time of year too, for college football and it's like sweater weather. It's still warm during the day and sunny, but the evening you need a little sweatshirt or sweater, which is perfect. And then finally, Mark, on a scale of 1 to 10, how would you rate your penmanship?
My penmanship.
Yes. 1 being awful, 10 being great.
I'll give it a 4. It's not the best. I am old enough that they still taught me cursive, but I haven't used it very often, so I've forgotten a lot of the capital letters. My penmanship's not great. I would say my family members and my wife know how to read it, but it could definitely look like chicken scratch if I'm in a hurry. So I'll give it a 4.
That is so funny. I actually was going to have a follow-up question. Do you write cursive? Because I know my adult children, they can sign their name in
Yeah.
cursive, and that's about it. Even though they were taught cursive in grade school, and why? You type all day, right? So
Yeah.
all right. Oh, well, great. Well, this has been super fun. I want to thank Doctors Allie Schlichter and Mark Nagel for joining me today. Thank you for listening in or watching in on the AIAMC podcast. We hope you'll follow us on our YouTube channel so you get notices of these podcasts as soon as they're aired. And if you don't already, please follow us on social. We're on Facebook, Instagram, LinkedIn, and Blue Sky. So I'm Kimberly Pierce Burke with the AIAMC. Take good care.